All right, welcome to Hygiene Elevated Conversations and Innovations podcast. Today we are joined with my dear friend Malia. Malia, it is such an honor to have you on the podcast today.
Yeah, thanks for
Now,
having me.
yes, oh my gosh, yes. And now, before we dive in today's topic, can you please introduce yourself to our listeners and share a bit about your journey into the dental hygiene world?
Yeah, so my name is Malia Lewis. Like Joffree said, I'm a clinical dental hygienist here in Utah, and I've been a hygienist for 16 years now, which seems like a lot, but also at the same time, there's still so much to do, which is happy. So I started in dental hygiene just because, of course, like a lot of people, my family was in dentistry. I have a father that's a dentist and he loved being a dentist, so that really inspired me to go into this path. And I'm not gonna lie, like when I was in hygiene school, I did not love hygiene school. It's a lot. It's overwhelming, and it's not like real life. So after graduation, I was like, I probably will only be doing this for a year and then I'm done. But just getting into private practice and seeing patients and really seeing like the effect we can have on patients really changed my mind. So 16 years later, dabbling in education and clinical practice and sales and all the things. Right now, I'm a clinical hygienist right here in the town I live, which I absolutely love because I get to treat and see my neighbors and friends, which is good and bad. And then I co-owner of Hygiene Edge, which is an online education platform. It's so fun because we can really deep dive into new products, new technologies, teach certain skills, because we know sometimes hygiene's really lonely. We're kind of doing our own thing a lot of the time. Sometimes we don't have anyone to collaborate with in our private practice, especially if you're the only hygienist there. So it's been such a fun resource for clinicians, assistants, dentists, everyone in the dental field to learn something new in a short, quick, easy way. So I own a couple different businesses, but I just love learning about the new, latest, and greatest to help our patients, but also to help me as a clinician just be the best clinician there is. So, yeah, that's why I'm excited to talk today a little bit about a new product that you can introduce into your private practice.
Oh, Malia, I love that story so much. What you thought was going to be like a 12-month journey has turned into like a 192-month journey and counting, right? So this
Yeah.
is like super cool that hygiene stole your heart. And I love that. You and I have something really strong in common where we're both quite the product gurus. And I love hygiene products so much and all the cool things that we can bring to our patients. So today's episode, Malia, if it's okay with you, I would love to focus on Clear Defense, which is described as the only nano silver fluoride available in the US. Can you explain to all of our listeners what sets this apart from the traditional silver fluoride products like silver dynamine fluoride and why this distinction matters for providers and patients?
Yeah, so it's technically the only nano silver like in this realm of dentistry, right? Nano silver is in a lot of different places. They use it a lot in the hospital, cleaning. Sometimes they put it on implants to help prevent infection. So silver has been tested for years about it has antimicrobial, antibacterial properties. So it actually, if you look back like in the history of silver, and maybe you've had patients come in and they're like, I'm using silver for my gingival health. And I'm like, ugh. But I mean, there is a lot of great research about silver and using it to help with antibacterial. Again, it's been used for years, hundreds and hundreds of years. Actually, kind of went by the wayside when antibiotics were developed, which is kind of interesting because antibiotics are amazing. I mean, we wouldn't be where we are without them. But now, with so much like antibiotic resistance and things, there has been a lot more focus on silver and how can we incorporate silver and what can we do. So we have been seeing silver again in dentistry for lots of years, but this is pretty fun and fascinating because it is technically a nano silver, which is a very, very, very tiny molecule of silver to help with antimicrobial properties, to help with desensitization, and just to help our patients in a little bit more non-invasive way than potentially like the traditional like composite filling that we've been doing for a long time. I really love how hygienists can incorporate it into our practices or support our patients in a different way. Again, something really non-invasive that we can apply. And the nice thing about the nano, we can talk more about it, is the the technique behind it is pretty straightforward. It's pretty easy to place. And so patients love that too because it's pretty quick. There's not a lot of like questioning how to apply it, and it can really help with someone's sensitivity. And then maybe some off-label uses too. We could use it in our practice. So it's the brand new on the market, just a couple months old. Lots of people have been using it and loving it, especially for desensitization in their patients with root exposures. And yeah, it's pretty fascinating. I'm really excited to see more people using it and more ways we can be incorporating nano silver into our practices to help our patients.
Malia, me too. I am with you on this. There is a ton of buzz going on around now about the Clear Defense. Would you please walk us through the ideal clinical scenario where Clear Defense might be used, either based on its on label indications or, if applicable, your own clinical experience and what you like about it? Go ahead, tell us all.
Yeah. Okay. Sorry, you're gonna have to maybe remind me a little bit, but um, the one thing that it's on label for is desensitization. So it's applying it to an exposed root surface, to a tooth that does get cold sensitivity, and helping fill in those little microtubules to help prevent that stimulus from going through. That's what the biggest research on for it. That is what the approval is for it. And a lot of silver products have that approval. That's what it's approved for, is desensitization in your practice. However, there are other ways we can apply it, and there is a lot of great research because it is antimicrobial, to help with potentially like arresting caries or preventing things from getting bigger in your private practice when it comes to decay. So again, we've been applying it on root surfaces and having people notice a big difference in their cold sensitivity on their root surfaces, which is great. Like if a patient has a sensitivity to cold, especially as we're getting into these summer months and we're eating more cold foods, if we can't eat the things we love or we want in the summer or any time, I feel like in Utah too, sometimes I'll have patients come in, they're like, I can't even breathe outside because it's so cold on my roots. That's like affecting their everyday life. And if the only option we have is to put a filling over top of that to cover it, I mean, that's better than nothing, but at the same time, it's kind of not the best because we have to remove tooth structure and then we have to apply composite. And sometimes those don't stay that well, as we all know, if they are clenching and grinding or whatever, their habits, things like that. And then sometimes if we've placed a filling, depending on the specialist you've worked with, they like disqualify from having any kind of gingival grafting in the future. So it's great to have a non-invasive option for their patients to help with their sensitivity. So with like a nano silver, all you have to do is make sure the surface is clean, dry it, apply it, let it dry for 5 minutes, and you're good to go. Sometimes they need a second application in a week or two, just again, depending on the patient and their sensitivity level. But it's really easy to place in the office. I mean, I've even done it on myself multiple times on sensitive spots, just to practice and to experience, but also just to see the steps, and it's been great. You can also apply it. This is definitely an off-label thing, but you can apply it to help arrest decay. So in any age, a lot of times people say like, oh, this is great for kids or geriatrics, which is true. It is great for those populations, but you can apply it on anybody to help arrest decay. So it doesn't restore the form and function of the tooth. So if it is like a bigger cavity and they need to have like a biting surface, it's not going to fill that gap, but it will stop the decay from getting any bigger. So it's a great option for patients that maybe can't see a traditional dentist, can't see a traditional like brick and mortar place. They can't afford it, or they just want something less invasive. But it can stop decay where it's at. It's not a one and done, just like most non-invasive things, even invasive things, fillings, they're not a one and done. They don't last forever. You want to check them regularly to make sure that the decay isn't progressing, just based on their diet and their lifestyle and their home health and things like that. But it is a great option to help stop decay where it's at to prevent it from getting bigger. So you could potentially like apply some kind of silver nano or SDF, but nano for sure. Let's say you have a patient that can't come they have a decayed area and they can't be seen for several months. And obviously we know, especially based on their diet or their saliva, things like that, that cavity is just going to get bigger in the next couple months. And then we're going to have to place a bigger restoration. So you could potentially place silver fluoride that day, stop that decay from getting any bigger. Then they're going to come back in a couple months and your filling is not as big. And this is such a great part of non-invasive dentistry, because if we're putting a filling on a brand new first molar, right? It's erupted when they're 6. No matter what size of it, that filling's only going to last a handful of years. Then they're going to have another one. Then they're going to have a crown and root canal. Like the life cycle of a tooth. And we are living so much longer now. We're keeping our teeth so much longer now. If we can avoid fillings as long as possible, just for that life cycle of the tooth, that would be amazing. So that's why a lot of times this is applied on kids, because if we can avoid fillings, that would be awesome. But anyone, we're going to keep our teeth for 100 years now. So if we can prevent restorations as long as possible, that is key. So obviously we can apply it for sensitivity. That's the on label. We can apply it under to stop decay. We can apply it to just like fortify areas. If you have a patient, again, that can't come to your traditional brick and mortar, maybe homebound, haven't seen dental care for a while, they do have areas of decay. We can stop that decay from getting any bigger. We could prevent a toothache. How awesome would that be? And just support our patients in a different way that maybe we haven't been in the past.
Wow, Malia, you hit on something really special, and you hit on the quality of care for our patients. And while you were talking about, our patients wanting to eat colder food during the summer, and alls I could think of, like, while you were speaking was like, wow, Malia is such an awesome hygienist. Like, she is really in this for the patients. Like, just listening to you, I could, like, really just hear and feel your passion about being a provider. So thank you first. But then also, the other thing you hit on that was really cool that I really is starting to match a lot of mainstream clinicians, where we do want to shift to a more non-invasive dental style. And Clear Defense matches that really, really well. So, for me, I see that as a trend shift in our industry. In your opinion, are you also seeing a trend shift as well?
Yeah. So I do want to say one thing, that a lot of the research with like silver fluorides, they don't include children in the studies, just because it's, when you do research on it with a child, it's tricky, it's a lot harder, things like that. So a lot of the research when you look up nano silver is on adults. I just want to say that. But a lot of people use silver on children as an off-label thing. So, but yes, so in my private practice, we have a pediatric arm, I guess. We could have like a section. I don't know how to say that. We have pediatric dentists and we see kids in a different way there, which is great. And honestly, I've never worked at a place with a pediatric arm. We'll just see kids, or like if we do referrals, if kids need that, things like that. And it's been really interesting at this practice to see these cute little kiddos come in and they just have all this decay and they've had it, it's tricky. So and then again, well, maybe they need like sedation or things to do any of the treatment. But if we can prevent that from happening or from actually occurring, or if we can prevent like a sedation case and do like other non-invasive things for a couple years before, as the patient gets older, it's huge. I mean, if we can kind of support these kids and help them as they grow up in this dental world, because when you've seen kids in a clinical practice, a lot of times their very first experiences in the office is what they're going to hold on to for the rest of their life. And if their first experience, I even have adults. Do you still have adults? Like I have adults that bring up like their childhood dentist and how maybe nerve-wracking it was, and it really affects how they come to the dentist still as an adult. So if we can make these great experiences at the start, their first appointment isn't a filling with all the things, the noise and the loud and the music, if it's an easy peasy, we're going to place some silver, nano silver or Clear Defense or something, and they're out of the chair and they're not going to have pain in the next couple months. I mean, that would be amazing. It just makes the whole experience so much better for that child and then their families. And it just is a snowball effect to keep them healthy and to keep a positive experience in this dental world. Again, like it's just so fascinating how we hold on to those experiences forever. So if we can keep them happy, that is the goal.
You're spot on. They do hang on to those experiences, and they bring them up and share them with their hygienist all the
Every time.
time.
Yeah. I just had
Yes.
patients this week like, oh, my childhood dentist did this and that. And I mean, maybe it's their perception. Like, I don't know if that was actually true, but at the same time, it's their perception. They're feeling those anxiety moments, even, 40 years later, 50 years later. It's pretty fascinating. And so I think sometimes in dentistry, we forget that, especially like me personally. I'm only going to speak for myself. Just growing up in a dental office. So a dental space is not too weird for me to go into. I'm like, this is old hat. I've done this for years and I've seen all the things and stuff. But just if you haven't grown up with that, or if you haven't been having those great experiences or your one-off experiences with the dentist with all these extractions as a child, no wonder it's going to be kind of nerve-wracking. So this is just a great option to help support our patients, give them another option too, instead of just saying like, oh, this is it, this is all we can do. If we can do a big filling on this tooth, maybe we could try something else and support our patients that way. People want options now too. I don't know if you've noticed this in like your life as a dental hygienist, but like people love to have options now. People are really educated. They like to do their own research and things. So having those options to help support them is great.
Yeah, you're absolutely right. Perception is reality. So when our patients have that experience that they're hanging on to, that is their story, and um, that's what's. My mind's always connecting pieces, puzzle pieces together, Malia. And earlier this morning, I am working on building a Canberra presentation, and I just am already. My mind is buzzing of how many places I can incorporate Clear Defense into my Canberra presentation. I'm like, "Oh, yeah,
Yeah.
I gotta make sure this product gets in there because it is a newer product." And so, but that's what this is about. It's about preventative care. We are preventative specialists. And, when we're talking about having anxious patients who may not want traditional restorations. This is a cool option, especially when we can find like those incipient caries or that hypersensitivity that they're experiencing. So I really like where this new trend is going. I think it's really cool.
Yeah,
Uh,
I think it's smart. I think it's great. Sorry, I didn't mean to cut you off. But I think it's great for hygienists too, because in a lot of states or areas wherever you live, you definitely want to look at your practice act and see if it's legal. But a lot of times, hygienists and maybe even assistants can place these non-invasive therapies. So it will help like hygienists like try something new and learn something new and like mix up your daily routine of maybe only scaling all day. You can apply these different things, support your patients, but then also support your practice with different modalities to bill out. So it's fun and it's exciting. It makes hygiene really interesting and really can mix up your hygiene day.
Oh, and there's so many changes happening in the dental world and in the hygiene space. We just finished up the lobby season. There's a whole bunch of new things coming out, and the whole center of it is access to care for patients. And this is a beautiful opportunity for hygienists to be treating their communities and really giving them preventative care. So I this really is matching up perfectly with the timeline of our profession.
Yeah. Exactly, and I think anything to empower hygienists, like, I'm all about that. I love that so much, like, because I think hygienists are I mean, I've said this before, I'll speak for us. We're just, like, such a smart, caring, lovely group of people that really want to support our communities, and so having these non-invasive options can really support our communities and help them and give them access that maybe they've never had before, give them options that say, like, "Hey, we can actually help you with something else other than, like, coming to my practice between the hours of 9 to 4 and getting numb and, like, doing all these things that people don't love." So it's great. I think it's definitely the way of the future of dentistry, especially to treat lots of people in a little bit more like cost-effective way. Non-invasive is the way to go. But we know that. Preventative, we've known that for years. Preventative and non-invasive is so important for our overall health. It's so much easier to prevent than to treat.
And we've been talking so much about this, but we haven't actually said yet, how is it applied to the tooth? Tell us
Oh,
how we are placing this on our patients.
yeah. So it's a clear well, when you do a little dropper, you only need 1 or 2 drops, and it comes in a bottle, and, that usually place is a placement for about 8 teeth, depending on like how big the site is and things like that. But really all you do is you just make sure the area is clean. So the brand recommends polishing with something non-fluoridated because it has fluoride in it. We don't want to get extra, we don't want to like mix up the balance. So we polish it, brush it, even if you're like in a non-traditional setting with something non-fluoridated, clean it really well. And then you're going to place like some basic isolation, especially if your patient has a lot of saliva. We want to just keep that area dry. So dry angles or cotton rolls, whatever you have on hand, cheek retractors, whatever. Then you're going to dry and you're going to place with like a micro brush, and you just want to let it dry on its own. So about 5 minutes. So if you're seeing a geriatric, like usually are okay opening for 5 minutes, letting it dry on its own, and then that's it. And then it is nice to double check it maybe in a couple of weeks, kind of follow up, see how they're feeling. You could test the hardness, see if it's still soft, but you can test the hardness and make sure that if you don't need a second application, some people do, just again, depending how like advanced or how soft their teeth are or how sensitive they are. So, and then just regular follow-ups, just make sure it's staying really nice and hard with the silver and the fluoride. So the silver and the fluoride work together. The nano silver is really, really tiny. So that's the nice thing about the Clear Defense. It has the nano. And when it is so tiny, it can work its way into those tiny little grooves, and it'll follow the way the bacteria has been going and kind of get in those, take the silver in there. And then the silver is an antimicrobial. So it'll get rid or kill, kill or break down the bacteria that's causing like the strep mutans or whatever that's causing the decay. So, and then the fluoride is really good. That's why it has the fluoride component, because now we have that extra mineral. We can use minerals from their saliva after it dries to help remineralize and harden that area. So the two together work really, really well. There's lots of great examples of them working together in both in dentistry and outside, but with fluoride in dentistry. So again, so the big point is the nano. The nice thing about the Clear Defense is it doesn't stain. I don't even know if we've talked about that yet, but some other silvers, how the silver ion works, it combines with sulfur in the filling in the decayed area. And when those two come together, it makes like a dark spot, which is kind of nice because then you can see that it's been applied and it works. But then you have a dark spot. So I think that's the biggest thing that I've seen in like pushback in my clinical practice. I work in like a traditional brick and mortar, is that it does, other silvers leave dark. But this is nice because it's nano, it doesn't combine with the sulfur, it will leave a dark spot on the tooth. So that's why it's opened more doors for people to be accepting of the treatment. Sometimes cavities are already dark, like filling is dark, so it won't change the color for those. But it won't stain like their recession. If it does have the start of a little cavity starting that we can't really tell, it won't stain that. It'll just fortify it and strengthen it and prevent the sensitivity from happening. So it's a pretty low-key procedure, which is kind of nice. That's why we can apply this in lots of different settings. You don't need a lot of like lights and like suction and things like that. It's pretty minimal. So that's why a lot of the people using it have been in non-traditional settings, like a school or a nursing home or a hospital, things like that. But we can apply it in our clinical practice too, to help prevent the sensitivity or decay.
So, thank you for explaining those for all of us. But, I'm kind of thinking when we're doing a Clear Defense treatment on a tooth, this is a very localized treatment option, right? We're gonna
Mhm.
put it directly on the area of concern, right? So
Mhm.
I'm curious with your patients when you are doing when you are using Clear Defense on their area of concern, are you still recommending like a fluoride treatment like you normally would at their 6-month intervals?
Yeah, and a lot of times I like putting it right the same day, right in there, just to give it some extra fluoride to help fortify that area after placement. But then, yeah, like nothing in dentistry, nothing is permanent unless you do an extraction, obviously. So we need to keep fortifying it. We need to keep up with their like individual home care. I mean, we could check their saliva, see what bacteria they have, things like that. It's not like anything we do, it's not one and done, unfortunately. I wish it was like that, but yeah, they should be coming in regularly for their hygiene visits. We do need to be applying fluoride depending on like their caries risk, like you mentioned, Camber, like it depending on their caries risk, what their saliva flows like, what their health history is like. We kind of have to tailor to what our patient is presenting with that day. But yeah, I do like to apply the silver, and then fluoride right over top of it, same day.
Now this nano silver ingredient, it just has me feeling really excited, to be honest. I'm like, my mind is just buzzing with all these ideas. Like, can you imagine like the future of like a silver nano varnish that we could apply generalized, or like mouth rinses with this, and like
Yeah,
all the things. Like
yeah,
the future is going to be really cool, and this is really the pathway to get there.
yeah. And there are some out there. They haven't been like super explored, I feel like, as much. So I'm excited to like introduce it and keep it growing and exploring. And it's all about like patient um individual care, right? Not everyone's going to benefit from this. We could say I mean, there's lots of great options. I mean, we could talk about it for hours, but it's really this individual care. What's going to work best for our patient based on all their things, because they're a whole human. They have so much going on, stress levels, family, home care, all the things affect their overall health. So really just having lots of options for our patients to give them that best individual care, and maybe that is incorporating nano silver in their home care. I think that is amazing. The more options we have and the more educated we are as clinicians to help our patients, I think is really going to help our communities.
Hands down, I agree with you 100% on that. Let's shift gears and talk about like the business side of this. I know as hygienists, our main vision is preventative care for our patients, but we are in the dental world where it is a business. And so when you are applying Clear Defense, what is your recommendation for pricing this for patients?
Well, this is tricky because it depends. Like it depends like how much you bought it for, how much time, how much overhead you have going into it. Really, this product doesn't have a ton of overhead, honestly, which is kind of nice. The most expensive part, if you're in a traditional clinic, is like your provider and chair time. But really, like when it comes to like extra barriers and things like that, you really don't need too much, which is nice. So I think it's so specific to your area and how much you want to charge. So there is a CD code for a CDT code for it, which is like local placement of fluoride, which we can put in the show notes because I can't remember off the top of my head. But a lot of like Medicaid does pay for it, and they pay not too bad for it. So you can definitely look at your different insurances, like what they're paying, maybe they're not paying for it at all, and kind of see. But because the overhead usually for it is pretty low, if you're looking at production numbers, it can really help your hygiene department, especially if they're the ones placing it.
Okay, you're right. Fair enough. It does depend on what area you're in, because that it changes our prices drastically. Let's see. If you were, for our listeners that Malia may be like, oh my gosh, I would love to get this in my office. How would you suggest that they propose ordering this with their practice owner or the doctor that they work for?
Yeah, I think just having that conversation, I mean, doing a little research on it, of course, is nice. Like with any new product or any new technique or something, it's great to do a little research and see if it applies again to your patient population. Because sometimes maybe your patient population only wants a certain thing, or only, it's just you kind of have to figure out what works in your office. But doing a little research, see how you could apply it into your practice. Make sure you have time in your hygiene day. If you're already seeing patients every 20 minutes, I mean, that might be really tricky for you to add on, I mean, it would have to be probably a separate appointment. And then just talking about maybe if you do like a morning huddle, or if you guys do a staff meeting or something, you could recommend, hey, I'm going to talk about this new product and how we can incorporate it into our practice. You can reach out to the brand, Young Specialties. They can give you lots of great information too about applying it and how you can incorporate it. But just really tailoring it to like your specific patient population, I think, is a great way to present it to your office staff. Maybe I think that with any new product, um, just to show how it will actually help your patient base that you see. So if you work in a pediatric, I mean, you could apply it that way. If you work with a lot of geriatric patients, you could say it's going to really help X, Y, and Z. If you work with a lot of like subsidized care, like you can figure out how much they would pay towards that, and you could present that to your office staff. I think just really, again, kind of like we treat our patients, we want to make sure things are customized to them. Same thing with your practice, really kind of customize how you could see it work into your workflow and make it feasible for them to realize and understand, hey, we could actually incorporate this and see this working in our practice. It's the nice thing about it too is, again, it doesn't have a lot of overhead. You don't have to buy like a light for it or anything. So it's a nice thing to try. I think once you try it, you end up really loving it too, but it's a really easy try. There's, again, you a lot of times you already have micro brushes and dry angles and things in your practice. It's not like you're adding all these extra different things that you might need that you might not have. So it's a great first step if you're wanting to look into something different. You're trying to like try different procedures in your hygiene department. It's an amazing, and it's a pretty quick and easy placement. So it's a fun way to mix up your hygiene day.
You're absolutely right, Malia. Thank you for sharing how to bring that up to your doctor, because one of my favorite things to incorporate is for the hygienist how to advocate for themselves and how to advocate for their patients and encourage them to do so. And so it is just really cool to get two hygienists on a podcast
Mm,
talking about, yes, hygienists can go advocate to get new products in the clinic. Hygienists can educate the entire team on what it does and how it can help our patients. So I really do appreciate you kind of walking us through that, how you would do that process. And then
yeah.
also, I'm wondering, I think a few of our listeners might be curious of like, how would you integrate this product into your conversation with your patient? How would you kind of tell them about it in like a quick little way that would have them have their buy-in pretty easily?
Yeah, I mean, we're in a really cool position with hygiene that we spend a lot of time with our patients. Like I think about that in other, like if you go see your doctor, your PCP, or whatever, like a lot of times you're in and out. It's a quick, but with hygiene, a lot of times we spend maybe 40 minutes, 30 minutes, hour with our patients. We get to know them really, really well. We get to know their health history. We get to know their stress levels. We get to know their family members. It's really unique and it's really fun. I think we can be hygienists can be such like a force for health because of that, because again, we know like the whole picture a lot of times with our patients, which is interesting. But I think as we're working, it's nice to bring it up instead of just saying it at the very, very end of your appointment. Same with like a fluoride varnish, same with like most treatments. Instead of just doing all your treatment, be like at the end, be like, hey, I really recommend silver fluoride on this tooth, and then that's it. You could bring it up like during probing, like if they have recession, or maybe you're using your ultrasonic and a patient is super sensitive to the water. Be like, hey, I have a new product that can help this. It's really non-invasive. We apply it. A lot of my patients have noticed a big difference. So I think just bringing it up maybe throughout the appointment instead of just at the very, very end, when after an hour and they're all like wet and they're like over it. And just want to get out of your chair. Have you ever felt like that? You sit them up and they like run out. You're like, wait. So bringing it up maybe beginning or middle, or when you doing something that could apply to that, is really helpful for all products we're recommending in hygiene. Um, and that really can kind of hit home like, oh, this could work, or this could be important. And then you could bring it up at the end later if you need to, or if you're not allowed to like recommend or diagnose in your state, then your doctor or whoever you work with could help diagnose that or implement that treatment plan, things like that. So I think just really caring. I mean, but hygienists are so good at this. We are so great. Just really caring for our patient, again, looking at their whole health and seeing how we can support them in different ways, not just scaling off calculus, but really helping those sensitive areas or helping their overall health is key. And silver, again, nano silver can really, really help. One thing I really like with this product too. So with other silvers, when I first learned them, I was like kind of trepidous about them because I'm like, this is gonna stain my op. right? Like if I accidentally touch my scrubs or my operatory and I have this gorgeous new operatory, things like that, like it is going to be, I'm going to have black dots everywhere. But with the nano silver, it doesn't stain the tooth, but it also doesn't stain hard surfaces. So if you have been interested, like I want to try a silver fluoride in my office, this is a great option to try because you're not accidentally going to touch your patient's face and have like a silver fluoride freckle. I mean, they do come off eventually, but or you're staining your new scrubs or spraying your countertop, things like that. And it really just takes that like edge off and just makes it a little bit easier to apply.
I really like how you said mention it while you're working, while you're doing things. Don't save it for the end because sometimes the end ended before you expected it to, right? They're
Oh
already
yeah.
out the seat.
They're like, I gotta leave now. I'm like, oh
Yeah.
shoot.
But it's in the name, clear, 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 clear. We can
Mhm.
apply this anytime during the appointment, and it is not going to obstruct our doctor's sight lines when they come in and do the exam. So I thought that was kind of neat that you could actually implement this anywhere in your appointment sequence.
Yeah. I've never thought of that actually. I've never applied it like before the exam because usually depending on the state you live in, like they might have to diagnose it. But yeah, I mean, that could be an option for sure. Of something you could talk about as a clinical staff and be like, can I apply this before the exam? Or can I do this, I don't know, X, Y, and Z, or should we just treatment plan it and they come back? Or if I have an extra 5 minutes, can I treatment plan it and place it today? Or yeah, I think it's a great conversation starter to have as an office and just see what works in your flow.
Yeah, I'm always encouraging co-diagnosing conversations within the teams because every provider is so different. And as the provider is on like their own journey as a clinician, like their opinions change. Maybe the doctor may never want the hygienist to help co-diagnose. And then in a few years later, change of heart. Actually, yes, I would like some help here. Go ahead.
Yeah.
So it's always changing. So it's really good to revisit those conversations too. If you were in a situation where it wasn't ideal, bring it up again if it's been a long time, like to have the conversation once more, see if things have changed.
Yeah. I mean, new research is always coming out. You never know what people are going to pick up on. It's just kind of interesting being like an instructor too. When, sometimes as an instructor, I'll say one thing and it like does not click with the student. And then the next week they'll go to a different instructor. They'll say the exact same thing and it'll finally click. I think that happens with teams too. Like sometimes it's just like time or place or like previous experiences. Maybe you could say the same thing a couple times and it just doesn't really click, but one day it finally will. Obviously, we don't want to be pushy and just like, I mean, there's a time and a place and a smart way to go about it. But I think just, sometimes revisiting things that weren't brought up and maybe weren't accepted before potentially could be with all the new research or the way people are communicating or what you're hearing online or things like that. So yeah, I think it's a great way to support hygiene and to support our patients to try something new.
Yeah, well said. Malia, this has been a really fun conversation talking about the on label, off label uses of these nano silver products. So I appreciate your time so, so much. I love ending the podcast with the two signature questions here. So the first one, Malia, if you could go back and give yourself a piece of advice as a new graduate, what would it be?
Yeah, I mean, I think I had some really great advice as a new grad, which was super helpful for me. I think the number one is never stop learning. That's a huge part. If we're still practicing the same way we did when we graduated, it's out of date. Sometimes the things we've learned in school are actually out of date. So keep learning, always keep up on what's happening. Even if your whole life isn't dentistry, that is totally fine. I want you to have a life outside of dentistry, but just kind of keeping up and revisiting or visiting things every so often to see if there's any changes or an easier way to do things. I think that's important even from day one, because again, it's a science-based career. Changes happen all the time. Things get redacted, things get like added. So it's nice to kind of keep a beat on what's happening. And then I think another thing is just keep in contact with like your local dental hygienist. So join like a study club or be a part of like your association or even like your office staff. Maybe if you do like a monthly little study club on a research article or something. I think it's important to keep those relationships in dentistry specific because when you think about hygiene school or maybe if you're in dental school, assisting school, you're all in this same boat. You're all learning the same things. You're all kind of really grouped together, and it's nice to have that support that feels the exact same way. And then you leave school and you're like, now what? I'm all on my own. I might like, I don't have that same support system. So it's nice to have like a local network, even just like even online, just connecting with other dental professionals, see what's working with them, see what's not. You'll learn a lot, but you also will just it makes dentistry a little bit more interesting to hear what's working for other people and maybe not, and then how you can apply it to your patients. So I think those are the big things. Always keep learning and then keeping some sort of network. I mean, my network has ebbed and flowed depending on my life, like if I have new babies or whatever. I mean, we get busy and things are going on, but just having that little resource is so helpful to have the support. And no one understands dentistry at all unless you're in dentistry, right? You have no idea what happens during the day. My husband is great. He's worked for dental companies before, but if I come home and I don't want to talk to anyone, like he doesn't get it. But we as a hygienist, sometimes we don't want to talk to anyone at the end of the day. So, and we get why. So it's just nice to have like a friend in the dental space and have that support outside, even again from day one of graduating.
Oh my gosh, Malia, you just steal my heart. Every time you get into your feelings on hygiene, I just love it. Listening to you, I'm like, oh, that's the perfect Malia answer because of all of your endeavors. Like, continuing education is your love language. I
True.
just loved hearing your response on that one. Now, the very last question I have for us is, what is something that took way too long to learn as a hygienist that you wish you would have learned much sooner?
This is a great question. Maybe that we don't have to be perfect. I don't sometimes with hygiene, we just wanna be perfect, and I think that's bred in us with, like, hygiene, and getting to hygiene school is really hard, and so you kinda have to be, like, a top performer-ish, to get good grades to get into hygiene school, then you're in hygiene school with all these type A students, and you're all feeding off each other, it's a lot. So I think and then you just wanna be perfect. We wanna be perfect for our patients. We don't wanna leave any little bits of, like, biofilm or calculus left, and we're human. That's not possible, depending on circumstances and patients and what instruments you're given and things like that. We can't always be perfect, and not every patient's going to love you. It's always so heartbreaking when you really try and you really, really put all your heart into a patient and they don't want to come back or they don't want to accept treatment or they haven't kept up with their home care. It can kind of just be like, oh, what am I doing wrong? But sometimes, it's out of our hands. We don't have to be perfect all the time. We're humans. We're always learning. That's why they call it practicing dental hygiene. We're learning and practicing literally every single day. And it's okay. I think it's a good thing. It keeps hygiene interesting. It keeps us human. And it's good to keep practicing.
Well said. Malia, thank you so much for joining me on the podcast today. Your insight is a great value, and many, many hygienists are going to love this episode. So just thank you. Big, big thanks from me.
Yeah, thanks for having me. I love being here. I love talking dentistry. So, and if you ever need me to talk dentistry, call me.
Oh, careful. I'll get you back. You'll be my next boomerang.
Perfect.